So what I wanted to do now is just take a couple of minutes to walk us through the program of action objectives, since we've referred to it quite a bit. You will see in the chat some links to actually go to the program of action if you need to go through that at your own time. So I just want to quickly say that if you look at the left there in that image, we closed off 2024 by unveiling our new strategy with our membership. And RHSC's new strategy is centered on an ambitious vision that all people have equitable access to a broad choice of safe, effective, affordable supplies needed to ensure their sexual and reproductive health throughout their lives. 4 strategic objectives underpin this, and that is availability, affordability, quality, and choice. These all anchor our strategy, and each are foundational to the achievement of RH commodity security and serves as a guidepost to reach our shared vision. Within the context of this new strategy, we went further and developed a new 4-year agenda, which is our 2025 to 2028 program of action that's on the right, and that was shared with you in March. This is structured around 5 programmatic objectives to guide our work for the next 4 years. And it is our hope that you will see the strategy as our location. Where do we need to go? And the program of action is a structured guide helping us figure out how we get there. Next slide, please. All right. So as you can see on the slide, we have shared with you the theory of change, and we're showing you how our program of action feeds into the delivery of our strategy. And our program of action identifies 5 key objectives. The first one is around promoting sustained and multi-sectoral collective action for advancing high priority reproductive health supplies issues. And then the second one is around expanding access to and use of quality, standardized, and aggregated reproductive health market data to drive improved reproductive health procurement and strengthen financial and production decision-making. Thirdly, we're looking to strengthen key market relationships and increase a broad range of supply chain efficiencies to support greater economic feasibility of reproductive health supplier participation in low-resource markets. And the fourth one is to promote a more diversified, coordinated, aligned, and accurately tracked financing approach to expand the resource base for reproductive health supplies. And finally, we would like to leverage the momentum around climate change in support of reproductive health commodity security. We have always recognized that the reproductive health supplies landscape is fluid and members' needs evolve, and they have over the last 20 years, though perhaps we didn't quite anticipate the radical changes of the last few months. This program of action is built to ensure flexibility. It allows for the identification of opportunities and emerging priorities in this dynamic landscape. It also recognizes a need to ensure that we're positioned to adapt as new issues are elevated across our membership. Next slide, please. Thank you. In the lead up to this meeting today, our implementing mechanisms met to identify their most pressing supply-related issues and opportunities. That was over 250 people coming together across 7 meetings and virtually to do hands-on work, brainstorm priorities, and crystallize what was most urgent and relevant. Here at a glance is the full list of priorities and opportunities that our implementing mechanisms wanted to work on. Now here's the magic. It appears that your priorities synchronize with the issues and actions identified in our program of action. And at the top, you will see the objectives listed. I just went through those in the previous slide. And what you're looking at, those priority items that were identified in those meetings fit squarely into each of these objectives. There are a few things that I need to mention, though. In the current reproductive health landscape, areas that were previously not an issue are now identified as top priority areas of focus by our implementing mechanism members. For example, you will see under Objective 2, the need for technical assistance in quantification and in-country public sector supply chain analytics, given the loss of USAID's technical assistance and support in that area. The second thing, which is not surprising, is a number of our members across the implementing mechanisms expressed concerns about local distributors losing interest and disengaging from local reproductive health markets, and the need for us to find ways to prevent the loss of distribution partners working with our social marketing organizations. And the last one, again, not surprising, in the current reproductive health landscape, the issue of climate change and catalyzing action around reproductive health supply resilience and climate change also did not come up during these IM group discussions. Nevertheless, identifying opportunities to integrate reproductive health supplies and climate-related investments and other efforts to aggregate best practices and evidence related to climate change across value chains remains a commitment for us at RHSC. Now, before we move to the next slide, the last thing I'm going to say here is as we looked at these priorities, we were able to identify 3 cross-cutting issues that emerged from these meetings. And I'll just go through them. If we could go to the next slide. The first thing we noticed is that across the priorities and sitting under different objectives, there is definitely a need for data and evidence to support decision-making. And this varies based on the health area or therapeutic area, and it will also depend on what folks are looking to work on. Can we move to the next slide, please? You can also see here that the other theme that we identified and that was emerging and was a recurring theme was around transforming reproductive health supplies financing. And can we move to the next slide, please? And the last one was speaking to our need to actually engage with the private sector at this point in time to ensure that they remain engaged and that we continue to partner with the private sector across different areas of the value chain.